You are watching the latest edition of the Wellness Hour. I'm Randy Alvarez. Today's topic is dental implant dentistry. If you are considering dental implants, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour. I'm Randy Alvarez. My first guest is Dr. Chip Casteen. Dr. Casteen received his doctorate of dental surgery at the University of Missouri, Kansas City. He is a graduate and fellow of the prestigious Mich Implant Institute of Birmingham, Michigan. He is a fellow of the International Congress of Implant Dentistry. He is an associate fellow of the American Academy of Implant Dentistry. He is the CEO and founder of Capital Dental Group in Bakersfield. He is the principal director of the Center for Implant Dentistry in Bakersfield. Under one roof, his team of doctors do just about every dental procedure, from making dentures to custom fitting implants and crowns. He's here today to discuss the latest advancements that have been made in dental implant dentistry. Dr. Casteen, welcome to the show.
Thank you.
First, tell me about this incredible office. It's not your typical dental office.
No, it's not.
Tell me about that.
Well, we tried to develop an office that would have enough room and be modernly designed so it could stay up to date with the latest advances in radiology and office design and chairs and so have you, especially sterilization, so that we could take advantage of that facility. It's, I still think like a student. What I mean by that is we like to be very convenient for the public. We're open 7 days a week, and that allows a lot of people that have jobs that tie them down from 8 to 5 to make either after-hours appointments or appointments during the weekend. My schedule is Sunday, Monday, Tuesday, Wednesday, and Thursday morning, allowing me 2.5 days off a week.
Let's begin with the other doctors. What are their roles?
I work with a great group of doctors, and these men and women, I have 3 other male doctors that work with me and 1 other female doctors, are all really conscientious, very solid.
And you have technicians also. I mean, when you walk in, there's that big glass enclosure.
Right. Well,
they're making things.
Right.
What's going on there?
Well, it was my idea, but I've always been impressed with businesses that allow you to peek inside of what's going on. When I get my car fixed, I kind of want to wander back and stare underneath and wonder what the heck's going on.
Okay.
So we have a scenario whereby from our waiting room, you can see our ceramicist make your crowns. And I think this is important because people ought to know the different not techniques, but the process by which and the detail that is necessary to create something very nice that goes in their mouth.
So they're making crowns. What else are they doing? It looks like they're making dentures.
Well, we have in our facility our own lab, and we have 9 laboratory technicians that fabricate all the removable and fixed prosthetic pieces that go in the mouth.
Now, normally, are these things that dentists send out?
Yeah, typically that's outsourced to a different business, either out of state or in the same city, perhaps.
How does this work as far as speed, delivering the work to the patient?
It increases our speed by about, typically we can get a crown back in the mouth in 5 days, and if we were to send it out, it usually takes about 2 weeks. But above and beyond that, what is so important is that for my type of work, which is comprehensive, rehabilitative, reconstructive dentistry, is without my technicians, I can't get out of bed because I need the technician at the chair to help me make those changes that are necessary to bring together what we need to do to get the job done well.
Okay, one of the reasons we invited you on the show, because in Bakersfield, you're the leader. You're the busiest dental practice out there. How do you keep efficient? Because people don't like to go to the dentist, I think, number one. And number two, they don't want to wait. You have signs saying if you're waiting more than 5 or 10 minutes, let us know. How do you keep it in line?
It's hard to keep in line, and I think the best way we keep it in line is constant detail to schedule, and it's a process of organization. In our office, we're extremely computerized and we're very computer dependent, and through being organized via our software, we're able to better categorize different people and their problems and assign different time elements to make their appointments go smoother.
Before we get on to today's topic, and we will, dental implant dentistry, I want to talk more about your office. You've gone out of your way to make it comfortable. You have plasma screens that are right in front of your face, it looks like, while you're doing the procedure. Tell us about that. I mean, why is it that important to make it that comfortable? You have art hanging all over the walls.
Well, we do. We have fantastic art, and it probably most businesses kind of they're a reflection of their owner. And I'm a very artistic guy, and my other half is an incredible artist. So we got like 90 paintings in our facility.
According to my notes, she did all the painting.
That's correct. And but furthermore, dentistry today is very advanced, and to reflect that, we have wonderful equipment, and part of that is we do have a small, thin plasma screen on every chair, and people just love to watch TV. Especially in the dental chair. It takes them away from what we're doing, and it helps relax them.
Let's begin with dental implants. You've concentrated your efforts on dental implants.
Yes, I have. And I'd say that was kind of a natural evolution for me. I would have never thought 15 years ago I would have virtually 90 or 100% of my time spent dealing with placement of dental implants and fabrication of prostheses that go on top of them, and dealing with soft tissue management problems and grafting hard tissue to support them. But that's where I'm at today.
According to my notes, you've spent about 800 hours studying and learning how to do dental implants. Why so much time?
Well, it's involved. It's a prosthetically guided tour. And what I mean by that is we have to be familiar with not only occlusion and aesthetics, but also the dynamics and biology of the soft and hard tissues, so that when people don't have enough hard tissue or the right kind of soft tissue, that we can go graft it and make things work out well.
Anticipating this interview, going into this thinking that all dentists had the same training when it comes to dental implants. And I guess somebody could take a weekend course and start doing dental implants, and you're dealing with bone and things like that. What are your thoughts about that? Because I guess anyone can do dental implants.
That's true. Any licensed general dentist can or has the license to place dental implants. And I think what you find is that the people that are really on the cutting edge of implant dentistry are all members of maybe one or dual members of several different societies. And these societies are principled around advancing implant dentistry and the techniques for implant dentistry. And they are the International Congress of Implantology, the AAID, the American Academy of Implant Dentistry, and also the Academy of Osseointegration.
So then what should somebody look for in a dentist that's going to be doing dental implants?
You should find somebody that does a lot of them. You should find somebody that
Ask your dentist, how many have you done?
Sure, why not? And furthermore, ask him for referrals of people that he's operated on. Say, listen, I'd like a list of the last 25 people that you cut on. Can I give him a call?
So there's a learning curve.
Absolutely.
I mean, you're better now that you've done
I'm a whole lot
well
better
over
than
1,000
I was
of these
10 years ago. You bet.
So what could go wrong then in the hands of an inexperienced dentist breaking into dental implant dentistry?
Well, I think a lot can go wrong because you're dealing with sometimes approximation of vital structures, nerves, and arteries that you need to avoid, different types of diagnostic problems where they've underdiagnosed the need and the number for dental implants. Dental implants has got its own learning curve, and it does take considerable amount of training to swallow the whole pill and digest it right.
Okay, we're going to take a quick break. When we come back, I want you to tell me who's a candidate for dental implants. I want you to take me through the process of what somebody has to go through, the downtime, the pain involved, things like that. Okay. You're watching The Wellness Hour. I'm Randy Alvarez. We are here with Dr. Casteen. We're talking about dental implants. We'll be right back.
Education is the key that opens a door to endless opportunities, adventures, and experiences. Without education, life is a continuing cycle of closed doors. This message brought to you by the United States Air Force, because we know the value of a good education.
Our hearts and prayers go out to the men and women who protect our country's freedom. But for an injured veteran, coming home often means being forgotten. Help Hospitalized Veterans provides arts and craft kits to VA hospitals around the country. They provide hours of enjoyable activities and effective therapy, too. Most of all, they tell our veterans how much we care. Help Hospitalized Veterans can also help you find a hospital in which to volunteer. To learn more, call 1-888-567-VETS.
I have macular degeneration, the leading cause of legal blindness for people over 65. I've lost my independence. I'm a burden to my family. I'm not alone. Almost 4 million of us have macular degeneration. 4,000 more will be diagnosed this week. It's a disease that destroys central vision, making everyday tasks a struggle. If you need help or information, call Macular Degeneration Research at 1-800-437-2423.
You're watching The Wellness Hour. I'm Randy Alvarez. We're talking about dental implants with Dr. Casteen. Dr. Casteen, what are the different types of implants?
Well, you basically have 3 types. You got implants that sit on top of the bone. Those are called subperiosteal implants. You got implants that go in the bone. Those are called endosseous implants. And then you got implants that go kind of through the bone, and they have plates that attach on the top and the bottom. They're called transosteal implants.
So what are the different categories then of candidates for dental implants?
Well, anyone missing a tooth is probably a candidate for an oral implant, whether you're missing one tooth or a group of teeth. As long as you have available bone, you're probably a great candidate for oral implants. You know, of people over age 40, there's probably 33 million people in America that are missing either a quadrant of teeth or a whole arch of teeth. That's a lot of people. That's about 80% of the population of Canada.
Okay, help me understand this. That's a lot of people. Help me understand, somebody just missing one tooth. Why not get a bridge or a partial? Or why even do anything? And especially, why would you want to get a dental implant? What are the clear advantages over a bridge or a partial?
The advantages of an implanted tooth over a bridge is that you don't have to disturb the other teeth. You know, as someone who has done hundreds and hundreds of bridges and thousands of crowns, the advantage of dental implants is very significant, because whenever I place a crown on a tooth, that has a certain life expectancy, and possibly, if they clean it well, that life expectancy might be 70% at 10 years.
Okay.
And dental implants can have well above a 95% life expectancy at 20 years. So in the long run, you do less work on your mouth just by having the implant than you would by having a bridge, because if a patient is, let's say, 30 years old and they are missing their front tooth and they're going to have a 3-unit bridge there to replace that tooth, they're probably going to replace that bridge 3 or 4 times in the patient's lifetime.
Now, what about the surrounding teeth? How are they affected by this bridge?
The surrounding
as opposed to a dental
sure.
implant?
Well, the surrounding teeth don't like it when I approach it with my diamond burr, and it's much better for the teeth just to leave them alone and to place the implant. You find that after you place a bridge maybe twice, the surrounding teeth need to be root canaled in addition to having a new bridge placed, and so it ends up being a never-ending money,
right,
I don't know what to say, dump.
I guess one falls out and then it just leads into a 2-tooth problem and a 3-tooth problem.
Sure.
I mean, these people that are out there that are in their 50s, 60s and have upper and lower dentures, obviously it started somewhere. Would you say that had you have met them 20 years ago, 30 years ago, or if they would have had implant, the technology they have today, that wouldn't have happened?
I would say if I could have just met them 5 years ago, or possibly 7 years ago. We can do so much if we can just diagnose things sooner rather than later. But there's better choices today than simply having bridges or partials. People can chew harder. You can leave the remaining teeth that are adjacent to the edentulous area, the area without teeth, alone, and it improves not only your aesthetics, but your ability to swallow. You know, many of my patients that have dentures end up swallowing their food whole, and this causes terrible digestive problems. The American Medical Association thinks that if you can't chew well and you are 5% impaired with your ability to swallow food, that it's a permanent impairment of your ability to through your digestive process. And most people don't know this, but 60% of the digestion for your body happens in your mouth.
In the mouth. And
a normal person like you and myself probably bite down with a force on our back molar of maybe 175 pounds per square inch. And if you're a person without teeth and you've been wearing your dentures for, let's say, 15 or 20 years, you probably don't bite down with more than 15 psi. And it takes 25 or 30 psi just to bite through a carrot.
Okay, let's talk then about those that are candidates, people that are watching this. What do you say to the denture crowd? They're wearing dentures either on their upper or lower. What could you do for them? I mean, how could you not only, how could you change their life? Really?
You know, we change their life every day. And we do that by, many times, when they have available bone, we just simply place 2 implants in the lower jaw so that we can snap down the lower denture so it doesn't float, and it helps stabilize the prosthetic piece. Not only does
so
it
just 2 implants?
Sure.
Okay, do you think that's the perception, that you need to do all or nothing when it comes to dental implants? Somebody's missing a full lower?
Yeah, I think perhaps, but most folks when they come in, we give them a wide range of choices so that they can understand that if they want, they can have teeth that are not removable, or they can probably use their existing dentures and just have them snap in.
So a snap-in, lockdown denture.
Sure.
That should change things.
Now, not only does it change things, but it increases the ability for the bone to stay where it's at and not atrophy through time. And that's really what our huge problem in dentistry is today with people that don't have teeth, is that it's a progressive process that happens for the rest of your life. You lose 40% of your bone volume in width 24 months after your tooth is taken out. And
so the bone just recedes?
The bone
slowly just goes away?
You bet. And we got to find better ways to prevent this problem from happening. And right now the best way to do that is place some dental implants in your jaw so it'll maintain your bone volume. Most of my denture patients, if they take out their denture, just the lower 1/3 of their face just caves in. And if you don't have a great foundation inside of there, you can't build anything on it.
What are the common misconceptions amongst the lay public about dental implants or amongst denture wearers?
I would say the first misconception, and it's not only about dental implants, it's about dentistry, is that it has to be a painful, horrible experience. The fact of the matter is with the new modern drugs that we have anesthesiologists that we work with routinely in our building. You can literally come in and be put to sleep and have all your work done and wake up and not know about it and not remember it and probably don't care to remember it.
Is pain not something that they complain about when it comes to dental implants?
Pain is always something people complain about related to dentistry, but I think we're really talking here about discomfort and not pain.
How predictable is the procedure? I mean, how do you know if it's going to stick or last? Tell me about that.
Dental implant therapy is very predictable. Our success rate is well over 95%, and that's much higher than other aspects of the body that not have dental implants, but rather, for example, hip implants. I think at 10 years they have a 70% prognosis. I would say at 20 years we probably have well above a 94% prognosis.
How long can they last?
I think they can last forever. I warranty my implants for my patients for their life. Granted, they come in once a year and have me take a Panorex of their head to make sure that they're maintaining their bone volume around that implant. The implants are very predictable. Most of the time, it's not a difficult procedure, and it's not a painful event.
We talked on the phone, and one of the things you said is that you wish people knew what you knew about dental implants. That if you could almost give them a trial run at wearing dental implants, and specifically for the denture wearers. I mean, does it really make that big of a difference? And we also talked about the psychosocial, how it affects their self-esteem and things like that. What do you hear from the patient?
It's just an incredible blessing. And what I mean by that is we really change people's lives daily.
How so? How so?
Well, so frequently people have horrible problems with their lower dentures, and they're not stable, they don't fit well, they constantly irritate the tissue, they can't swallow food well. And when you take someone who hasn't swallowed, medium food in 5 or 10 years and you allow them to chew food well, it changes the whole dynamics of their life. Not only in the choice of foods that they're able to eat, but also in social ways as well. A lot of my patients come to me and they say, Doc, how am I supposed to get romantic with my new wife when my denture is falling out?
Right.
And so these kind of issues we can help resolve as well.
So when the procedure is done, what are they saying to you? I mean, is this one of those things where they say, I can't believe I waited this long to get it done?
That's my favorite part of the business, because to see people's reactions when they've had or missing 3 teeth and they've been wearing this thing that flops around their mouth, and they look in the mirror and they see beautiful crowns supported by implants. It changes the whole way they look at themselves. And I don't know how to describe this, but you see it in their face, and you see it in their eyes, and you see it how they care for themselves. It's just they can't really believe it. And they're always looking at me going, you know, I don't know why I didn't do this 10 years ago.
Is that right?
Tell me why. Tell me why.
Okay, we're going to take another quick break. When we come back, I want you to take me through the process, what somebody can expect if they go to your office. You're watching The Wellness Hour. We're talking about dental implants. We'll be right back.
America's wolves represent a bond with wild nature and connect us to a time when our country was mostly uncharted. Centuries ago, the gray wolf flourished here, part of nature's balance of life. This land was vast, and about 400,000 wolves roamed free. But by the 20th century, bounty hunters and trappers, financed by our government, effectively eliminated them from all but 2 states. Their numbers dwindled so low, their very existence was in doubt until they were granted federal protection under the Endangered Species Act. Although they have made gains in recent years, wolves face a new struggle for survival, for there are still those working to eliminate them. The wolf, as other wild animals, has its place in our great land. Save something wild. Visit SaveWolves.org.
Hi, girls. You know how we tend to live longer than the guys? Well, then that means we have more years of living expenses to pay for, which means it's especially important for us women to save for retirement. So put some gold into your golden years. If your company offers a pension plan, or if you qualify for an IRA, then use it and save, save, save. To learn more, you can call 1-800-998-7542. Again, it's 1-800-998-7542. And do it now, because saving matters.
You're watching The Wellness Hour. I'm Randy Alvarez. We're here with Dr. Casteen. We're talking about dental implant dentistry. Dr. Casteen, take me through the process. Somebody goes to you, they want dental implants. What can they expect?
Well, they're going to come in and they'll probably go to the reception area and they'll meet Ashley, and she's just the funnest thing on 2 feet. I call her Spice Child.
Okay.
And so the Spice Child's going to bring you back, and we'll have you go through our Department of Radiology. We have just the best, most up-to-date, computer-generated films that you can possibly get, and we do that in one large screening film for no charge, and then I sit down with you and give you some options.
So you meet with the people one-on-one, everyone?
Bet. Absolutely. And we spend about 15 or 20 minutes going over the radiology with them and describing to them what different types of scenarios we can...
You said you wanted to be known as the dentist that shows people all their options. What do you mean by that?
Well, I mean, everyone's got a budget that they need to stay within. And in life, most everything comes down to time, love, and money. So under those constraints, we figure out what's best for them.
Okay, you call it a treatment plan. Tell me about that.
Well, a plan of care, a treatment plan, is something that you just design for the patient after you listen to them describe what their dreams or intentions or expectations are. And for different people, it's different things. For a young female who's just lost her front tooth, it's pretty straightforward and simple, a single implant in the front of her face. For someone who's 68 and has worn dentures for 30 years, it might be something very different.
So, but those 30 years, somebody watching this that says, I've been wearing dentures, Dr. Casteen, for 30 years. I mean, what can you really do for me? Those people could or would be candidates. You bet. And in fact, most of our patients, I'd say 85% of our patients are females, and that's because females, well, in my perspective, they're the better of the species, but they're always trying to protect themselves and take care of themselves. And usually the male is harder to get into dental services. But for someone who's been wearing dentures for 20 or 30 years, they have a whole wide variety of options. You know, it used to be that probably when you had dental problems, they went in and patched things, and then you came back in a few years and they patched some more things. Well, things have changed quite a bit, and we're able today to really resolve dental problems in a wonderful way. You said patchwork. What do you mean patchwork? Well, many years ago, when people came to see the dentist, oftentimes they would just have the dentist treat one tooth instead of looking at the entire mouth. So one missing tooth, what would you do? The best thing to do in the old days would be to put a bridge there or maybe a partial denture there. Why is that a mistake?
That's a mistake because there's such better options today. And with the advent and improvement of dental implants, you can just replace that tooth with an implant and get a great service out of it, probably for the rest of your life.
So that one tooth problem leads to more decay, the surrounding teeth getting loose. Is that what's going on?
Oh, that typically happens over one's lifetime. And that's where dental implants can be such of a great benefit to people, is that they're a very wonderful long-term solution to a bad problem.
Back to dental implants. A teenager, let's say I'm a teenager, I fall off, my skateboard knock out a tooth. What's a turnaround time on a dental implant? And are they candidates, by the way?
Yes, they are. And normally I can just take that tooth out very, very carefully. And if I got enough surrounding bone, I can sneak an implant in there the same day. I can put an abutment, something that sits on top of the implant that sticks out of the gum a little bit. And I can put a nice provisional crown on that, sew it up, and they can be out the door in hour and 10 minutes with a new implant-supported provisional tooth going out the door.
But in that aesthetic zone, can you make them look real? And how do you match them to the rest of the teeth?
Well, we're just good at what we do, and we can make it look real. In fact, most of my cases, if you were to stare closely at the teeth that had implant-supported crowns, you just can't differentiate them whatsoever from the adjacent teeth.
So other people won't know they have dental implants?
That's correct.
Okay, and the fact that your labs are there, does that help you in any way as far as the art to this, matching them up?
That helps me huge. I just can't get out of bed without my wonderful technicians. These people are very, very experienced. I have what I think are probably some of the better technicians in the San Joaquin Valley working with us. And it's so helpful, and the patients recognize this because they know that it's hard to make something look like nature. And they know that because of their previous experiences with other dentists, that it's very difficult getting that customization that they really require to make them look whole again. And that's what I love about our business, is that we so consistently can bring that to our patients in a very smooth way.
We're just about out of time. What do you want people to know about dental implants?
I would say I'd want them to know that it's very predictable. It's probably more affordable than they recognize. We have different businesses that will, if creditworthy, loan people maybe up to $5,000 or $6,000 interest-free for 12 months. It doesn't have to be painful, and it can probably be better than anything they could ever imagine.
Now, you walk them through the process, because sometimes, I guess, if it's a full mouth reconstruction, you're married to that patient maybe for a couple of months or more. Is that right?
I'd say I'm married to most of my implant patients probably for their life, simply because of my warranty.
You say warranty. What kind of a warranty do you have?
I warranty our dental implants for the patient's life. If they come in.
Forever?
Yeah, forever. All I want them to do is just come in once a year and allow me to take an x-ray of their jaws so that I can make sure that everything is up to date.
Okay, a recap. Not just on dental implants, but your practice. Because you're doing everything. You have a team of dentists. You do more than just dental implants. You do children's dentistry. Tell us about that. And we have a few minutes left.
We do all phases of dentistry. We do children's dentistry. Dr. Cotter and Dr. Logan are just wonderful people. Dr. Logan has 2 children himself. His wife is just a great gal. She was a nurse. And he's so good with kids. I can't do kids to save my life, all right?
Okay.
As soon as a child starts crying, my reaction is, let's get them to Toys R Us. Go get them some food, whatever, all right? But Logan's got a great style about him in regards to treating children, as does Tiffany Cotter. It's a wonderful opportunity for someone who's got children that needs access to dentistry on the weekend or in the evening hours, can get their needs taken care of.
So you do whitening, orthodontics. Is that right?
We do everything. And what I mean by that is we got a way to make your teeth white in about an hour. You can come in,
1 hour.
pop in the chair, bam, you're out in an hour. And I can't believe the results we're getting from this. Furthermore, we have orthodontics available. We treat children. We do, all the other types of fillings and procedures that you need for the oral cavity. We have hygienists available 7 days a week. It's pretty special.
Dr. Casteen, we're completely out of time. Final thoughts.
If you've been ignoring your mouth for some time, for any reason, just give us a shot. I think we have one of the nicest facilities in the state. We have a wonderful staff.
Dr. Casteen, thank you for coming on the show. Very interesting.
Thank you for having me, Randy. It's been my pleasure.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like information about future airings of this program or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.